Good evening and welcome to the August 24th school committee meeting. I will start by taking attendance. My name is Robin and I'm here. Mr. Conroy?
Here.
Mr. Catalano?
Here.
Ms. Gibbons? Here. Ms. Roach?
Here.
We don't have any teacher or student reps. And Mr. Blaney?
Here.
So our meeting is being recorded and can be viewed on Mondays at 7 p.m. on Comcast Channel 8 or Verizon Channel 37, as well as live streamed right now on YouTube. All meeting videos are also posted on the Millis Public Schools website under School Committee, and all times are approximate. Judy, has anyone signed in for open session?
No.
Okay, no one is here for open session, so we'll move on to our action items. We have a consideration to approve the school committee meeting minutes from last Tuesday, the 18th.
Madam Chair,
Mr. Catalano.
I make a motion to approve the school committee meeting minutes from August 18th, 2021.
Second.
It's been moved and seconded. Any further discussion? All in favor?
Aye.
Aye.
Motion carries unanimously. Consideration to approve the Millis Teachers Association Unit B collective bargaining agreement.
Madam Chair,
Mr. Conroy.
I make a motion that we approve the Millis Teachers Association Unit B collective bargaining agreement that we have already approved in executive session.
Second.
It's been moved and seconded. Any further discussion? All in favor?
Aye.
Motion carries unanimously. Consideration to authorize the Director of Finance and Human Resources for school to sign amendment number 4 with Compass Group USA.
Madam Chair,
Mr. Catalano.
I make a motion that the Millis School Committee renew its contract with Compass Group USA and its Chartwells division for the 2021-2022 school year, and that it authorizes the Director of Finance and Human Resources for schools to sign amendment number 4.
Second.
It's been moved and seconded. Any further discussion? All in favor?
Aye.
A consideration to approve the quote from Signet for Intercon systems.
Madam Chair,
Ms. Roach.
I make a motion to approve quote number 12422 from Signet for an intercom system for the middle high school in the amount of $65,600.
Second.
It's been moved and seconded.
Madam Chair,
Any further discussion? Yep.
my action items on my thing says $78,268.88.
It's
Yes.
crossed out.
Yes, so Mr. Wiggin sent a memo to us about that came in kind of late. It's in the packet. Hold on, I can pull it up. Or do you want to speak to it, Mr. Miller?
Sure, yeah. So the amount, the original amount of $78,268.88 was in excess of what we could spend on it. And so we got a new quote of the system without the clocks being synchronized with the system. And without the clocks, the new amount of the quote was $65,600, which is within the parameters of
Okay.
what we have to spend.
So
on
we
it.
need to update, unless the agenda is updated online, it's not, is
Yeah,
it?
the agenda
It
is
is.
updated
Okay.
online.
All right. I'm good.
Okay, good. All in favor?
Aye.
Motion carries.
I did.
So we're going to move into the chair report, and we're going to talk about our back-to-school policies. So last meeting, we met and we voted on a revision to our mask policy that all students are going to be masked, and we'll be reading that shortly. Do you want to give a quick update?
Sure,
Mr. Delaney?
and since that meeting, which was held on Wednesday evening, on Friday afternoon, the Commissioner of Education had a conference call with superintendents and said that he was planning to petition the State Board of Education to authorize him to institute a mask mandate for all Massachusetts high schools, middle schools, and elementary schools, pre-K to 12, until at least October 1st. This morning, he went before the board and they voted to approve giving him the authority to do so. So there is a statewide mask mandate. It also includes some of the elements that were discussed at Wednesday's school committee meeting. The commissioner's mask mandate would include that after October 1st, 2021, if a school demonstrates a vaccination rate of 80% or more of all students and staff in the school, as well as some other unspecified metrics that the state is going to be looking into, then those schools with the 80% or more vaccination rate of students and staff would no longer be subject to the state mask mandate. It would still be a decision for local communities for vaccinated individuals. The 80%, the commissioner reported that the 80% threshold had been agreed to by the Department of Public Health. And that once schools reached the 80% threshold and received approval from the state to lift the mask mandate, vaccinated students and staff may remove their masks. So it would only be vaccinated students and staff who would be able to not have masks after October 1st if the vaccination rate and some other unspecified as yet metrics were met. And so he as noted, he did indicate that vaccination rates would not be the sole determinant for unmasking.
Madam Chair,
Yeah, Ms. Roach.
because since there's now a state mandate for masks, does that negate our mask policy? Do we still have to have a mask policy? I guess it's more of a question.
My recommendation would be probably to still have it because, you know, if after October 1st, Millis, you know, met the requirements of the state, but, you know, the CDC or someone else had different
Or
metrics.
the Millis Board of Health suggested that we.
And also, I think it's important to note that the 80% doesn't mean we have to adopt 80%. That's the minimum, that's the floor. And so, in fact, I think it's important that people know is that there has been no determination made by this committee that 80% will unmask vaccinated people. We started the conversation today in health and safety, and the preliminary discussion, some of the Board of Health and nurses were not necessarily keen on just 80%. No determination has been made. That would be something we would bring back to the full committee. But 80 was a good place to go. But just because we reach 80 doesn't mean we as a committee have to automatically unmask vaccinated people. So that conversation started today. It was also included in the conversation was, what did we agree on? Either transmission or transmission rate, but also what is going on individually. So there's a quantitative component and a qualitative, just how are things trending, I guess, which would be quantitative. But we are starting that conversation, and we will continue to report back out to this committee on where we're going. But sorry, Bob, I'm cutting you off, but just the other piece was a discussion around this is not going to be an honor system. People are going to, both students and staff are going to have to produce a vaccine card in order to be unmasked. It's not required, but if they do not produce, it would be considered that they're not vaccinated. And we started the conversation about how to do that tracking. More information to follow from the health nurses and the Board of Health, but I think I covered, is that enough on the mask? That's what we covered on the mask, right?
Mm-hmm.
Okay.
Yeah.
Thanks, Bob.
Madam Chair. So a follow-up on a couple other questions I have as we move forward to how we treat whether it's 80, whatever the percentage is. I think a question we have specifically for this building is, how do we treat high school versus middle school? And, you know, that's question one. Do we treat high school and middle school differently, even though it's all one building? And if the answer to that is yes, We then have the 6th through 8th, the middle school in and of itself, and how do we handle that? Because obviously 6th grade is in this under 12 category, and it's a third of the middle school. So you can't get to 80 until 6th grade is eligible, and then 80%, at least 80% of them get vaccinated. And so even if it's ultimately decided we have to treat this building as one, that 6th grade is going to factor into how long it takes us to get to 80%. So I think it would be good for the Health and Safety Committee to start looking at that sooner than later. Again, just so that we can, we've been extremely transparent in how we're moving things forward. But I think it is one of the comments and questions that I think is absolutely valid is, what are the metrics that we are going to get to? How are we going to measure this so that when we get to that point, October 1st is now the first kind of touch point. What are we looking at? The state is giving us some guidelines, but it's saying by school. How do we have to treat school? Maybe that's a question we bring to DESE, because if I'm reading this, when we deem we're at 80%, we have to go ask them. Are they going to consider it the same way that we do? So that's the one thing. And then the second is, to Mr. Catalano's point about vaccination proof. I would be comfortable if we as a committee, if we felt it was necessary, outside of the mask policy that we have, draft another policy specifically speaking to what's required in order to be considered vaccinated. I mean, it would, in my mind, it's very simple. You've either proven it and it's been verified, or you're considered unvaccinated. We're not, as Mr. Catalano said, we have had no discussions about mandating vaccines for anybody. However, if you aren't going to prove that you're vaccinated, we have to assume you're not. And if it's easier for the administration and primarily the nursing staff for us to draft a policy to do that, I think we should, instead of it being them having to deliver that message and having to fight that battle on a daily basis. Again, something in the next few weeks we probably should decide whether to do, but I think it's worth considering doing that.
So one thing was discussion was we've determined, and we're going to do a quick check, that vaccination documents can be emailed to our server because it's secure. And then Mr. Mullaney is going to start looking for giving some resources, maybe in the form of a substitute nurse or others, so we're not taking away from direct care by the nurses, but start to, we're talking over 1,000 entries. And we're hoping that the numbers come in, because going into the system is burdensome and time consuming. So we're hoping that, and what the nurses have said is people have already provided at their own.
Yep.
So I think if we can get some notice out before, we have to do a little more checking, and we get those in, that will start to help us at least not address the bigger issue of the middle school, high school, but at least start to feel what is our vaccination rate just at first glance, right? And so we don't want to burden the nurses, but we do need to make sure we're meticulous about it and we have an accurate number.
And we will be sending a communication out, looking for nurses who would be interested in subbing in our district.
Speaking of communication, what you sent out the other day, the 2 documents were very helpful, I thought, to kind of disseminate what we went over at the last meeting and how the test and stay works and things like that. So thanks for doing that.
You're welcome. And we did, we also discussed the testing options in Health and Safety Committee today, and we are going to go forward with the test and stay option. and there'll be more information coming out on that. There is a parent consent portal that we'll be sending out to people so they can give their consent online to their student. And the CIC Health, who is the provider, the state has contracted with to run the testing program. So that information will go to CIC Health, and we'll have access to that for people who want their students to be able to test and stay. And I think it's also important to reiterate that the definition of a close contact hasn't changed. It's 6 feet, within 6 feet for 15 or more minutes of a person who's test positive. However, if you are vaccinated and you are a close contact, you do not have to quarantine. So there's another incentive to get the vaccination.
Unless you show symptoms.
Right, unless you are symptomatic, correct.
Asymptomatic people do not have, right?
Correct. So an asymptomatic, vaccinated, close contact does not have to quarantine, does not have to test. So there is another incentive to have as many people as we can vaccinated. And, you know, if over at Clyde Brown where they can't get vaccinated, you know, that's where certainly there'd be people who would want their kids to have that consent to test their kids so that if they were deemed a close contact, they would be able to stay in school if the rapid test was negative. And they would test for a minimum of 5 days. And if there were a school event on the weekend, like a concert or a game or something, then someone who is involved in the test and stay program would need to be vaccinated over the weekend if they were going to participate in that concert or in that game.
Tested.
Tested.
Tested, I'm sorry.
That's
I said
okay.
vaccinated.
Yeah, that's fine. There's a
They
lot
need to
of.
be tested, thank you, over the weekend. And we do not conduct those tests on the weekend. The nurses won't be giving tests on the weekend. So if that scenario arises, then it would be up to the family to go to a medical facility and get a rapid test and produce a negative result from a medical facility to the activity director to participate in that activity. over the weekend.
Not an at-home test.
Correct.
A test done at a licensed medical facility.
Correct, right. An at-home rapid test would not be sufficient to have the kid participate over the weekend. So I just want to get that out so people are aware of the testing protocols.
Would they have to test that day?
Yes.
So just, and I don't know if it exists, because I don't know what everyone's schedule. But if you had a Saturday morning 9 a.m. game, it is highly likely you won't be able, because
You missed that game, yeah, yes.
so it has to be on the day of the event.
Yeah. And then, you know, if something happened over the weekend, if you tested 4 times at school, and then the weekend, you have the weekend, when you come back to school, you'd have to test 1 more time at the school to be able to stay. You know, if it happened on a
If it was
Monday.
like a Tuesday.
Right, exactly. If you were deemed a close contact on a Tuesday, your testing would go from Tuesday to the following Monday. If it happened on a Monday, you'd go Monday to Friday.
So
Madam-
5 days tested within school, so
Correct.
5 days tested within the school. But if there were school activities over the weekend, you have to show proof of negative rapid test
Within those 5 days.
with, well, on those two,
On
let's
the-
say
on
Saturday,
the
Sunday.
Saturday,
So if you have something on a
Sunday,
Saturday or
right.
something on a Sunday.
Correct.
Now, who is responsible for looking at that? So my son, let's say he plays football and they have a game on Saturday and we rapid test him. Does he bring that to the coach? Does he
I
send
think
that?
that would be something that would be brought to the trainer. You know,
Okay.
would alert the trainer.
Okay.
You know, the trainer
This
would
is just
know
gonna be,
who
this is a
was- who
lot
was-
of tracking and has
It
a
is.
lot
And we,
of.
It is.
just to
And-
be
and-
fair, we just started the conversation.
Yeah,
We
yeah,
have not,
yeah.
but
Sure.
that was brought
Yeah.
up.
And to Mark's point, there could be circumstances where it's unlikely that the student would be able to get the test. Again, it's kind of another incentive to vaccinate.
Madam Chair, or Mr. Mill, maybe it's Mr. Because I missed the health and safety meeting today. Was there any discussion around, so I'm assuming this, so close contact becomes a town of Millis issue, right? Where the town, the Board of Health is tracking close contacts. So how does this test and stay, does this translate to non-school activities? So if they have, you know, a Bay's soccer game on Saturday, requirement doesn't go to a town sport.
Correct, right. And you bring up a
Unless
good
Bay's adopts
point.
it.
You bring up a good point. If someone is a close contact from something outside of school, they wouldn't be eligible for the test and stay. It's for close contacts in the school.
No, I understand that.
Yeah,
I'm just
no,
thinking
but
like
that's
if
just
it's a
another
close
addition.
if you're a close contact in general last year, that you got a call from the Board of Health and they gave you the guidelines, and it didn't matter if it was a school or it
Right,
didn't matter
right.
that your quarantine rules were the same. So now
Right.
we're saying that there may be different quarantine rules if you're a close contact for school versus outside of school.
Right, and that's a very good point too. If you were in the test and stay protocol, and on the weekends, it's strongly encouraged that you quarantine yourself for the weekend. If you didn't have any school events or anything, you quarantine yourself. So really, you shouldn't be going to your town, your AAU soccer game or something like that. That's
It's going to get messy.
That's the recommendation the Board of
So-
Health would give.
So, Madam Chair, just to follow up on the question Ms. Rota, so this test and stay only pertains to in-school cases.
Correct.
So last year, the vast majority of the cases, especially in the middle school, high school, were around recreational sporting and recreation activities outside of the school.
Mhm.
If they are a close contact based on that, they will be out of school,
That's
is
my
what I'm
understanding.
hearing, because they can't
think-
come in on Monday and test and be part of test and stay.
Right, that's my understanding.
Okay, that's a,
It's an important distinction to make
Absolutely.
for the community going forward.
Yeah.
Because
We
there
will-
will be
I can double
cases.
check that.
Yeah,
I'll
I think we just
definitely
need to
double
make it.
check
And
that.
I know we're really early in this, and we're all kind of just talking out loud because this is very early for us in this program. But I think we have to make it really clear to the community what the expectations are, not of the school, but of it's even the town, right? Of
right.
if you're a close contact, when you qualify for test and stay versus if you're a close contact, there's other quarantine rules that you'll have to follow unless you're qualified for test and stay.
Right, correct.
Madam Chair.
Ms. Gibbons.
So I feel like this flows into a little bit of the conversation that we had last week, which is our protocols, not policies, but our protocols around close contact, quarantining, even if we're just referencing what the Board of Health has, because last year, all of those were crafted by the nursing staff and then provided to the community. We have to do a whole nother round of that now based off of the newness of everything that's going on and all of that, so.
Yeah, and I think we should separate out in school versus
Yeah.
out of school close contact so that parents know.
We could start, I think this is an assignment for the health and safety to
Yeah.
start to draft something to bring back to the committee. So
Maybe
I
start
think,
by looking at what we had in place last year.
and how it can
and
be,
how it
how
can
it's
be-
modified, how it's changed.
Yeah.
And I think it's a fair question, and we do need to get as clear as possible. And, we're still working in conjunction with the Board of Health. The Board of Health may have different restrictions, for weekend activities, right? I don't know,
That aren't dictated by us.
that are not dictated by
Yes.
us.
Right,
And whether other
Yeah. And I think-
recreational activities or leagues subscribe or coordinate, we don't know, but
Right.
all very valid questions
And I
and
think you should
points.
separate it by vaccinated and unvaccinated too, because those I think are different requirements now.
Right. And
Right, I think it's
in
a
terms of
quarantine
quarantining.
policy, and then you may have a section for vaccinated and a section for unvaccinated. I
And then
agree.
in school, close contacts and close contact, when you're tapped close contact out of school.
There's a
just-
million scenarios that we
Yeah.
have to address.
Yeah,
That's fine.
yeah.
That
And
is-
again, if a person is vaccinated and they're asymptomatic, then they don't have to quarantine.
No
Whether it's
matter. where they
Outside
are.
of school,
Right.
inside of
Vaccinated.
Right,
school.
right, that's why I'm saying, like, it would
Yeah.
just be good to have all that spelled out in
Sure.
one space. The only other thing I
We may
thought
wanna-
of was,
We may want to schedule next week.
yeah,
Madam Chair, can I just
Yeah.
make one more point, just
Yeah.
for the general public, that
Yeah.
I know that there was questions, or I've seen stuff about why are we waiting so long to talk about these kind of things? So I think it's just important to bring up once again that this is, this test and stay and these programs are brand new. We're just getting this information in the last week or so. We just had to apply for it last week. So we're reacting as quickly and thoroughly as we can, but it's literally changing almost every day.
right.
Madam Chair?
Mr. Conroy.
I just want to, so, I'm sorry, and I know things may be different, but in the presentation Mr. Mulaney gave last week, it said the DESE and DPH protocols are responding. The following close contacts are exempt from testing and quarantine. Classroom close contacts while both individuals were masked and spaced at least 3 feet apart. Okay, because earlier tonight you said it was 6 feet.
Well, close contact, they're still a close contact, but they're exempt from having to quarantine.
If they're both masked.
If they're both masked.
Right.
Both individuals, so if we sit next to each other in a class and we're both masked, and I turn out to be positive, you're a close contact, but you don't have to quarantine because we were both masked while we were 3 feet apart in a classroom.
Does that only apply to classrooms?
In the scenarios that the state sent to us, yes.
What do you
Because
mean,
we,
So
In the
cafeteria
So-
too, right? So if you're unmasked, the only,
Well, if you're unmasked-
In the cafeteria,
Then
yeah.
you're a close contact. But if
unless you're 6 feet, unless you're further than
Right.
6 feet.
Right.
Correct.
But,
Yeah.
so, and I don't want to jump too far into winter, but, so volleyball now is going to practice inside with masks.
Yes.
They're not in a classroom. Presumably, at least some of them are within 6 feet of each other during practice.
Mhm.
If they are unvaccinated, because vaccination exempts you, if you are unvaccinated, are we quarantining?
So,
So that's what I'm at.
right,
Like,
I
so
think
that's where,
that would be a test, if the parent consented to testing, that would be a test and stay.
Because it was a
Situation.
school-sponsored,
so
Okay.
we,
If you're identified as a close contact,
and you can test and stay
you can
because
test
you're,
and
it's a
stay.
school event.
Yeah.
Okay, but you are, but it is, the distinction is, we are going to treat it as
As something
a
that,
test and
needs
stay
to-
and
they're
not
within-
an
they're within
exemption.
3 feet.
right.
So-
And if they don't test, and if they haven't consented to that, it would be a quarantine
So,
situation.
so for athletics, we are looking at being in a test and stay that the 3 feet with a mask only applies while you're sitting in a classroom.
Yeah,
Seems like a
and we
fair-
can look to get,
Seems like a
we
fair
can look to get
assumption.
I'm just-
clarity on that.
Yeah.
The state sent out an FAQ on some of the aspects of it, but a question like that was not included. So it's, it's a question we can definitely ask.
I would make a recommendation that the committee, we do a brain dump and ask all of kind of the scenarios or issues that we have. We then bring that to health and safety and start to go through that. Because I'm not trying to stop the conversation, but I also want to, the superintendent, we're operating with just brand new information, like Ms. Roach said. I think all of these questions are legit. I think it may be a better use to kind of, we all go back, we come up with our questions, we put them together, we group them in buckets, which we've
Yep.
done in the past, and then health and safety starts doing their work, right?
Completely agree.
But we're not going to have answers tonight.
No. But we also, I think to your point, maybe health and safety needs to meet maybe a little sooner. Sports started yesterday. School starts in a week and a half. Some of this stuff, hopefully we're not in that scenario, but if this stuff starts to become questions, the sooner we can vet this and communicate how it's going to be dealt with, the better. Because we were dealing with it, completely new last year. But we got into situations last year where we were dealing with it one day, the first day of school, we're dealing with it one way. 3 weeks later, we're dealing with it in a different way. We just have to.
We have a meeting we had a meeting scheduled. We'll now put that back on the agenda. We ran through some scenarios today, so we can start again.
And the only last thing I want to mention is is there going to be a list given to coaches so that they know that kids can't play because they're in this test and save program and they couldn't get a test? Like, how are coaches going to know?
That's a question I think we'd
Right,
add to the
right.
list. We did not think, I mean,
Who's keeping track of that?
And again, I think that's a situation where the communication with the nurse and the trainer
Sure.
is.
And the Board of Health with us for the
Right, which
for
they've
the
been great
right
at.
Yeah.
for the people who impact the school.
Okay. Any other comments or questions about this? So the only other thing I think that we have on this topic is we have to read the mask policy one more time. Any volunteers?
I'm happy to read it.
Thank you, Ms. Gibbons.
I mean, that's fine.
Do we need to make a motion or can we just read it?
I'll make a motion, and then while Ms. Gibbons is pulling it up, I just have one question.
Sure.
So I'll make a motion that we, third reading and amendment of policy 5.11.7, policy for face coverings.
second.
Moved and seconded for the discussion.
So the question I have is, do we want to incorporate, and maybe we do it at in the last sentence where it speaks to when we modify, do we want to include anything in there that speaks to the October 1st date and the 80% state kind of first?
I think it should say until October 1.
This policy will remain in place at a minimum until October
Yeah,
1.
that's how the DESI stuff reads.
So I'm fine, I'm okay with it saying exactly what it is,
Me-
and
me
maybe
too.
it's in accordance with DESI, it'll be reviewed around October 1st to determine if we have 80% vaccination rate in our building, and I don't know, something off to say we're going to look at it on October 1st.
I'm concerned about putting 80% in here because that has not been, unless we're agreeing to 80% right now, I'm not ready to do that. So if you put 80%, people could read that 80% means unmasking.
We should at the very least, put in something referencing the October 1 date.
I agree with that. I think that's a
This
safer.
policy will be revisited October 1st.
Or we leave the sentence, because I don't want to take it out. I don't want to take the sentence out that says we're going to take it away on October 1st or give any inclination to that. But maybe leave that sentence and just add a next sentence that says the school committee will review this around, because really we should be looking at our vaccination rate in advance of October 1st.
Sure.
We'll know what that is. Hopefully we'll have some further guidelines of what's going to get us in position to request approval from the state.
Sure.
Because that sounds like that's going to
I
be
agree with, in and around.
So October 1st is a Friday, and we have just talked about our potential October meetings being the 5th of October. So,
We could have a one-off meeting on the Thursday night.
okay, I'm just saying, we could just say October 5th.
Yeah, we meet on the following
We're
Tuesday.
going to meet on that.
First is a Friday,
Oh,
this
I
Tuesday.
Okay. I understand.
Doesn't
Which-
have to be on the actual first of the,
No, but should we?
that was the recommendation, right? We're
No, that's when we.
potentially already meeting
right.
on the 5th, so
But,
we can chat
I mean,
about
we're probably going to be talking about this multiple times, but
Yeah,
it. Yeah,
I was thinking we would have at least initial vaccination
numbers.
numbers, ideally, at least what we have.
At every meeting.
Right, by at least the 20, so if we're meeting on the 5th, then I'm assuming we're meeting on the 21st of September.
We're gonna, yes, we just talked about.
No, 28th.
The 14th and the 28th
Okay.
are September.
So then the
meetings, tentatively.
28th, again, I would think we
That's
probably,
close enough.
the 28th will, again, in the policy, I'd say around October 1st, so we're not held to a specific date, but in
I'd say by the first
practice.
week in October.
Madam Chair,
Miss
I
Gibbons?
just have a small bit of apprehension about putting dates in the policy.
Yeah.
So I actually like the way it reads right now, knowing that I don't know of any other policies that we have that actually have dates in them. And I understand that this is unique and uncharted territory. But I do think that it is, like, we put it as topics on agenda, we commit to discussing it at every meeting.
Yep.
I, for one, would like to leave it as is and not include a date within the policy. Just as a general practice for policies to not include dates in there about we'll revisit or and at least until X date or whatnot.
I agree with you, just because I was concerned about putting 80%, however it's couched. We just had a 10-minute discussion about we want to discuss this. We're going to discuss it multiple times. We can't do anything until October 1st, so I'm okay with
Madam Chair.
keeping the language as is.
When we voted to go remote last year, we put in this October 14th date as when we would have evaluated. So we have precedent around this that acknowledges when.
So what is your concern, Mr. Connor?
I-
Why do we need, I'm not fighting you on this, but why do we need to put October 1st in this
Because
policy?
it acknowledges that right now, because it acknowledges that the element of the state's policy in ours. So the state has it that it's at least until October 1st.
And it's
We're-
what we said we would do in the last meeting.
I don't recall that we said we would include a date in the policy.
We said we were
No.
going to discuss it, we
We
had
would
not
talk
set a
about
date.
thresholds.
This
We
policy
would,
was
that
to-
we would talk about a threshold.
a threshold and a time frame.
And it, yeah.
Yeah. Okay.
I mean,
I don't
what,
need to make a big deal about it, so I'm okay if we want to say will remain in place at least until
At a
October.
minimum.
I wouldn't,
First.
I would leave that sentence exactly the way it is.
Yeah, and then
And then
add,
just, the next sentence is, the school committee, in accordance with DESI guidelines, the school committee will evaluate this policy around October 1st. Or the school committee will evaluate this around October 1st in accordance with the DESI guidelines.
I'm writing it down.
And you could probably just leave it at that. Because then we're not speaking to exactly what the DESI criteria is. But we're acknowledging that we're going to follow the DESI.
The school committee will evaluate this policy on or about 10/1/2021 in accordance with DESI guidelines?
Yeah.
Okay. At the end?
Yeah.
Okay.
And you want to add that after the line that says the policy remains in place until modified or suspended by
Yeah.
the school committee?
Yep.
And I want to clarify again that October 1st is the minimum. 80%
Yeah.
has not been agreed to by this committee.
Yeah,
correct.
We may.
right. But that's why I don't want to edit the first sentence, because the first sentence
I gotcha. Yep,
unequivocally states, this is in place until we take it out.
okay. I'm good. Thank you.
That's right.
So we've got a motion to do the reading, a second motion from Steve, and now the motion is to add a paragraph?
Just a sentence.
Just a sentence, and then I'm going to read the amended policy.
Okay, so add the sentence.
I'm going to add the sentence of, the sentence is, the very last sentence of the entire policy is,
Just above the legal record.
Yep.
Right.
the school committee will evaluate this policy on or about 10/1/2021.
We'll reevaluate, right?
Yes. Reevaluate is correct.
Okay, reevaluate, Jody, sorry.
School committee will reevaluate this policy on or about 10/21.
In
10/1/21.
Yep, in accordance with DESE guidelines.
I can add that to the policy. I will add that to the bottom revised.
Perfect.
Under the 8/18 date, I will add the revisions today, and Denise is going to read the policy.
You got it, I sure am. Yep. Okay. Policy number 5.11.7, face coverings. Millis Public Schools, policy number 5.11.7, policy for face coverings, updated August 18th, 2021. In accordance with guidance from the Centers for Disease Control and Prevention, CDC, the Department of Elementary and Secondary Education, DESE, the Massachusetts Department of Public Health, DPH, and the Millis Board of Health, the following requirements are in place until further notice. A face mask is required for all individuals while in buildings owned or operated by Millis Public School District and while in any transportation vehicles owned and operated by Millis Public Schools. Individuals may be excluded from the requirement per CDC guidance and applicable law if the individual is having trouble breathing, is unconscious, is incapacitated, is unable to remove the mask or face covering without assistance. In addition, masks or face coverings will not be required for anyone who has a medical, behavioral disability, or other challenge making it unsafe or not possible to wear a face mask or face covering. A written note from a physician or medical therapeutic specialist specific for rationale required for a requested redemption. Request will be reviewed by the school nurse to determine if an exemption will be granted. Parents and guardians may not excuse their child from the face covering requirement by signing a waiver. Face mask or face coverings will not be required during mass breaks, while eating or drinking, during outdoor recess, outdoor physical education, outdoor school sports, and outdoor learning environments. Social distancing will be encouraged during all of these times. Student masks or face coverings will be provided by the student's family or guardian. The district will supply a disposable face mask or face covering should an individual arrive at a building or board school transportation without one. The district will have face masks available for all school staff and for students whose mask becomes unusable. Guidance on acceptable masks, face coverings. The following types of masks, face coverings are acceptable to wear at school, on school grounds, and on school transportation. Blue disposable surgical masks to be replaced daily, not to be washed or reused. Fabric masks, preferably with at least 2 layers of fabric. Face shields along with a surgical or fabric mask. The following types of masks, face coverings are not acceptable to wear at school, on school grounds, or on school transportation. Masks with vents, neck gaiters, plastic face shields alone without a fabric or surgical mask. If students are in violation of the policy, the student will be isolated and the building principal or designee will consult with the student and parent or guardian. If that is unsuccessful, the student will be removed from the building for in-person learning until such time as they can comply with the requirement or the requirement is lifted. Violations of this policy by staff will be handled in the same manner as other violations of school committee policy or expectation. This policy will remain in place until modified or suspended by the school committee. The school committee will reevaluate this policy on or about 10/1/2021 in accordance with DESE guidelines. Legal references, Commonwealth of Massachusetts, COVID-19 Order Number 31. https www.mass.gov doc May 1, 2020 masks and face coverings /download. Centers for Disease Control and Prevention, considerations for wearing masks. https www.cdc.gov /coronavirus /19-NCOV /prevent getting sick /cloth face cover guidance.html. Massachusetts Department of Elementary and Secondary Education, reopening guidelines, http www.doe.mass.edu /COVID-19 /ondesktop.html. Commonwealth of Massachusetts mask up masks. https www.mass.gov news mask up mask. DESE guidance as of 5/17/21. We should probably reference the most recent DESE guidance too in here, Jody. Sorry.
Which is,
I'll give it to you in 1 second. https /docs.google.com /document D followed by many letters. LF2AV9PLNXUARJOQEA711 J5CWJHAWYENGH /edit. and our source is the Mass Association of School Committee, August 2020. We do need to add a legal reference for the DESI guidance as of Friday's date?
Friday.
8.
Oh, it might be as of
Now, they
today.
took the vote
Today.
today.
Yeah, so it'll be as of
So-
today.
I have the authors, it's not a,
8/24?
right, it's 8/24. It's not a web page or anything, it's just authorization for the commissioner to require masks for students and staff in grades K to 12 through at least October 1st, 2021. That's the title of the document.
I would just send that to
Maybe
Jody.
do
I don't
DESI
think we need
guidance.
to try to,
Maybe we just do DESI guidance as of 8/20.
yes.
Yeah,
that's-
I'm wondering
Or
if we should
21.
actually remove the 517 one. I just don't, I tried to click on it, but it
Some of
didn't
it's
work.
probably from that, though.
Some of it may be.
leave
Just
it.
add it.
Yeah.
It doesn't hurt to just add it.
Yep.
If you could, nope,
Nope.
nope, if you just add DESE guidance
As of 8/20.
as of 8/24/21.
That's right.
After, yep, so before source, yep, before source.
And then there was just one part where you read where it said the following types of masks are acceptable to wear at school, on school grounds. We can strike the on school grounds part because outside they don't have to wear masks. And the same thing for the next one, the following types of face coverings are not acceptable at school and on school grounds.
Yeah,
Right.
so page 1, Jody.
Also- I can send you my revised edits here that I'm making.
I know, I can't edit this. Oh, I
Wait,
could
let's
if I
make a
did
copy
open
of
with
it.
Google Docs.
That was just a link that I put on the desktop into my folder so I can have it.
Yeah, no, I didn't open it, I just pulled it as a preview.
Well,
Okay, so
if
Robin will
we're gonna
provide.
edit, it's not we're at school, we're in school and on school transportation, in schools. I think we just leave it. I don't think, we clearly state that we're only requiring people to
Indoors.
wear them indoors. I think, well, we can edit if you want.
Okay.
Okay, so for the update, we added the DESI guidance. Jody's got the extra sentence at the very end. We're leaving everything else?
Sure.
It's fine with me.
Thank you, Denise.
We're done. Have to vote?
There's one.
To take
You have
the
to vote on it, right?
Sorry.
No, no.
All in favor?
Aye.
All opposed? Any abstain? Motion carries. So we just have one bit of old business, new business, if you guys will see in the folder. There were a couple of invoices that came in after the meeting was posted for us to approve. So I will need a motion for, I think there's 3 of them.
Madam Chair,
Ms. Gibbons.
I make a motion to approve an invoice in the amount of $6,039.60 for,
There's a number
oh, thanks.
on it. Invoice.
For invoice number V13396, in the amount of $6039.60 to VAR Technology Finance.
Second.
It's been moved and seconded. For the discussion? All in favor?
Aye.
Aye.
Motion carries.
Madam Chair,
Ms. Gibbons.
I make a motion to approve invoice number V11019 in the amount of $13,215.50 to Renaissance.
Second.
It's been moved and seconded. Further discussion? All in favor?
Aye.
Aye.
Motion carries.
Those are for subscriptions for Star Math, Star Science, all sorts of online.
Michael.
Sorry, I should say that. Madam Chair,
Ms. Gibbons.
I make a motion to approve invoice number V236 in the amount of $8,000 to the Accept Education Collaborative.
Second.
It's been moved and seconded. Further discussion? All in favor?
Aye.
Aye.
Motion carries. Thank you, guys. I think that is it.
Madam Chair,
Ms. Roach?
make a motion to adjourn.
Second.
All moved and seconded. Any further discussion?
Executive session?
No, there
There is
is
none.
none in the packet.
Excellent. Okay, sorry. I'll be quiet.
All in
It's on the
favor?
agenda. You need to go into executive, so you will not be going into executive session.
I don't think so.
No.
I don't think we have anything.
All in favor?
All in favor?
Aye.
Aye. Motion adjourned. Meeting adjourned.
Denise did.
Denise did.
I did.
Yeah. No executive session.
I forgot.
Thank you.
Thanks.